So we will be moving the patient up in bed using the draw sheet. So I'm gonna first ask a family member or judge to assist me in the skill. I'm going to make sure we both wash our hands for hand hygiene, and I'm going to explain to the patient that we're going to move them up in his bed. I'd make sure that I would instruct the family member the whole time on the skill that we're going to do and make sure she's comfortable doing it. Then I'd make sure to place a pillow at the head of the patient to protect the patient's head. Then we're going to roll down the sheet on the top of the bed so that it's not in the way of the patient. And then we are going to place the patient's feet 12 feet apart and 12 inches apart and with their knees up. Okay. And with the hand nearest to the patient's feet, I'm going to instruct my partner to do so as well. We'll grab the bottom side of the draw sheet, and then the top closest to the patient's head will cradle underneath their head and their shoulders, grabbing the bottom of the sheet. I'm going to tell my patient that we're going to move him on the count of 3 and make sure that my partner feels comfortable to do so as well. On the count of 3, we'll move the patient. 1, 2, 3. Scooting the patient up towards the head of the bed and adjusting, make sure the pillow and the fitted sheet is clean and underneath the patient. Again, lower the patient's feet, making sure it's 12 inches apart. Then we will bring the top sheet back over the patient. Then I communicated the skill properly with my partner. I completed the skill and will record it on the record sheet, and I was very verbal and proper communication with my patient, and I practiced standard precautions throughout the skill.